Welcome to The Explainer. Today, we're going to unpack a massive shift in how public health science answers one of its most important questions. What is actually making us sick? We're taking a journey from the old-school fight against big tobacco all the way to the modern challenge of obesity to see how our very idea of what a cause even is has been totally revolutionized.
All right, let's just dive right in with a question that honestly seems almost silly today. Why in the world did it take so long to officially prove that smoking causes cancer? And the answer? Well, it's not just that science was slow. It's this incredible story about how the very tools we use to find a cause had to be invented from scratch and then later on completely reinvented.
So I want you to picture this. It's the 1950s. Lung cancer rates are just going through the roof, and doctors are noticing something. Pretty much all their patients are smokers. The evidence was piling up, right? But the tobacco industry, well, they spun up this huge campaign to create doubt, hammering on this one idea. Just because two things are connected doesn't mean one causes the other. This high-stakes battle really forced the world of public health to come up with a systematic, almost legalistic way to prove its case beyond a shadow of a doubt.
And that was the absolute heart of the challenge. I mean, you can't ethically run a perfect experiment where you force one group of people to smoke for 30 years and another group not to. It's impossible. So scientists had to figure out, how do we bridge that gap? How do we get from just seeing an association to proving a cause? This need gave birth to what we now call the classic framework for causal thinking. Think of it like a detective's checklist for epidemiology.
So let's take a look at this revolutionary toolkit. It was developed back in the 1960s, mostly by a guy named Sir Austin Bradford Hill. And it was designed to give scientists a structured way to evaluate all the evidence and build an absolutely airtight case against a suspected culprit, like smoking.
Now, what's so brilliant about these criteria is just how practical they are. It really is like a prosecutor building a case in court. Is the evidence strong? You bet. Smokers had something like a 20 times higher risk of lung cancer. Is it consistent? Yep, studies all over the world kept finding the exact same thing. And maybe most important, temporality. Did the smoking happen before the cancer showed up? Yes, it did. This checklist gave scientists a powerful, pragmatic way to build an overwhelming case that was just impossible to refute.
And let me tell you, it was a massive, massive success. This framework was the backbone of the 1964 Surgeon General's report that finally, officially, linked smoking to cancer. It was a total game changer for public health. But as the kind of health challenges we face started to change, the very thing that made this checklist so powerful, its simplicity, started to become its biggest weakness. Okay, now let's see what happens when we try to use that same classic toolkit on a much more modern, much more complicated problem, the obesity epidemic.
So you take that classic checklist, right? And you ask the question, does obesity cause death? And if you go down the list, the answer looks like a pretty clear yes. The association is strong, it's consistent all over the world, it checks a lot of the boxes. So case closed, right? Obesity is a cause of mortality.
Well, not so fast. And this is the exact point where the old toolkit just falls apart. Saying obesity is a cause, it's like a detective figuring out the butler did it, but having zero clue what weapon he used or how to stop him from doing it again. It identifies a problem for sure, but it gives you no hints about the actual solution.
I mean, just look at all these possibilities. The real issue is that obesity isn't a single action you can just stop, like you can stop smoking a cigarette. It's this incredibly complex state. Is it the sugary drinks, the lack of exercise, the portion sizes, something else entirely? The classic checklist, it offers pretty much zero guidance on which of these things, if any, will actually work to save lives. So this very problem, this dead end, it forced a complete rethink, leading to an entirely modern approach, one that starts by shifting the question itself.
And this slide just nails the difference perfectly. The classic approach asks this big, broad, almost philosophical question. The modern approach, it asks a super specific, practical one. See, it's not asking about obesity in general anymore. It's asking about the real-world consequence of a very specific action we could take, like a tax on soda.
This whole new way of thinking is built on a really powerful idea called the counterfactual. It's basically a formal way of asking, what if? What would the death rate look like in a world without a soda tax compared to the world with one? It forces you to think like an experimenter, even when you can't possibly run a real experiment.
So what's happening here is that this new framework uses some pretty sophisticated statistical methods to simulate those impossible experiments. It totally moves the conversation away from these vague risk factors and forces us to get incredibly precise about the actual actionable policies we want to study. Okay, so all this sounds pretty great in theory, but what does it actually look like in the real world? Why should, say, a policymaker care about any of this?
Well, here's a perfect example from the U.S. Environmental Protection Agency. When they set air quality standards, they actually use both frameworks. First, they use the old checklist to establish that yes, a certain pollutant is likely to cause harm. But then, and this is the key part, they switch to the modern what-if framework. They model these specific scenarios, giving policymakers concrete data. They can say, if we reduce this pollutant by 10%, we estimate this many lives will be saved. If we reduce it by 20%, even more. It turns a scientific finding into a real, actionable policy choice.
And that really gets to the heart of it, which this quote from some of the leading researchers in the field just sums up beautifully. The new methods move us away from the philosophical exercise of identifying causes and force us to consider how to improve health. See, the goal isn't just to name the problem anymore, it's to find the best solution.
This whole evolution, from a simple checklist to a sophisticated what-if machine, it's not just some nerdy academic debate. It is absolutely essential for tackling the kinds of challenges we face today.
Because let's be real, our biggest public health crises now, they're not like smoking was. They're not a single clear-cut bad guy. They're these messy, complex, interconnected systems, all tangled together. The old toolkit, which was designed for a much simpler problem, just isn't equipped to deal with the crazy complexity of things like global obesity or the health effects of climate change.
And that leaves us with this final, really critical question. The whole story of finding causes shows us that progress isn't just about finding answers. It's about learning how to ask better and better questions. In the future of public health, it might just depend on our ability to fully embrace this shift, to move from simply finding the cause to precisely estimating the effect of our actions.